Welcome back to From Fear to Fun, the podcast where we explore how to transform medical encounters with children from moments of fear into opportunities for fun, with connection, confidence, and cooperation. I'm so glad that you are here. Today's episode focuses on one of the biggest challenges for our communication in medicine. How do we communicate complexity in a way children and parents can actually understand? Medical information is complicated. The body is complicated. Illness is complicated. And emotions make everything even more complicated. If we want to empower families to make sensible decisions, we must learn how to reduce complexity without losing truth. Let's explore how. The human body is a network of interdependent systems. A small change in one area can create unexpected effects in another. When we try to explain this to families, we often overwhelm them, not because they lack intelligence, but because the information is unfamiliar, emotionally charged, delivered under stress, full of jargon, and often too detailed. If we want to empower children and parents, we must break complexity into digestible chunks. This is not dumbing down, it is translating. Imagine two images of the Eustachian tube. One is anatomically perfect, full of details shown from multiple angles. Here, a piece of the skull is cut away to allow the view on the anatomical structure, but losing the context of the situation. The second one is simplified. It is slightly incorrect in the size and the correct position of the Eustachian tube, but it is designed to explain the connection between the nasopharynx and the anatomical side of the middle ear. The first is accurate. The second is useful as it is designed to explain the function. Accuracy is not the goal of communication. Understanding is. When we choose visual aids or words, we must ask, does this help the patient grasp the principle? If not, it's too complex. Speaking to medical students, I hear frequently of them that the majority of their training focuses on difficult conversations, especially breaking bad news. Hearing that, I'm not surprised that they stumble, because breaking bad news is a highly complex conversation in itself. So I would like to suggest to start with the first step first. And that would be to build rapport. Connection comes before information. This entire podcast series has explored the obstacle to connection: fear, assumptions, cognitive load, and inner storylines. Once rapport is established, the next question becomes, how do we speak so that they can understand? By now, the goal is clear. It is not to teach anatomy, it is to help them understand what's happening, why it's happening, and what they can do about it. A good test is simple. When the patient and parent starts asking questions aligned with the principle, you hit the right level. That moment when understanding clicks is true empowerment. Now, with the goal in sight, we are looking for strategies to reduce the complexity. Let me start with 3 strategies to do this. Strategy 1: demonstrate the underlying principle. Before you start the explanation, ask yourself the following question about the condition: the underlying physiology, pathophysiology, phases of disease, treatment steps, and potential follow-up. How can I break this into chunks? And what do they really need to know right now? Another aspect of this background analysis is about their situation. What does this situation look like from the child's perspective? From the parent's perspective, what impact will they feel? And what tools do they have to cope? Only when we understand the principle can we translate it. The second aspect would be to put the principle in a black box. Black boxes are wonderful. You don't need to understand how a Swiss precision watch works to tell the time. You trust the mechanism. The same applies to medical explanations. A black box model has 3 steps. Something triggers a process, something happens inside the process, and something comes out as a result of the process. Patients only need to understand the first and the last step. The internal mechanics often confuse more than they help. Highlight what they can control, the input, and how it affects the outcome. Step 3. Translate the concept into the patient's world. A picture tells more than 1,000 words, even an imagined one. Say pink elephant, and the image appears instantly. We can use this power to explain complexity through metaphors, analogies, simple drawings, or mental images. But the illustration must come from their world. Younger children need different images than teenagers. Parents need different images than children. This is translation, not simplification. I would like to strongly encourage the use of pictures and simple language. Drawings are helpful when you repeat the same explanation often. They can be customed with a few lines to match the child's situation. Mental images are more flexible, but less tangible. And simple language is essential. I always explain the condition to the child first. This naturally simplifies the languages. It reduces parental anxiety and respects the child as an autonomous person. When the child understands, the parents understands. In a nutshell, medical information is complex and must be simplified to be useful. Understanding matters more than accuracy. Rapport must come before explanation. Complexity can be reduced by demonstrating the principle, using a black box model, translating concepts into the patient's world. Visual and verbal illustration can make complexity digestible. Explaining to the child first naturally forces us to simplify the message. Reducing complexity is not about lowering standards, it is about raising understanding. Thanks for joining me on this episode of From Fear to Fun. In our next episode, we deal with another challenge for any conversation with patients and parents, the question of uncertainty. Until then, keep noticing, keep wondering, and keep moving from fear to fun.